last thing older Americans and Americans with disabilities need is a tax hike. But the debt problem causing our economic challenges has been bipartisan. We've generated that from both sides of the aisle. National debt at the end of fiscal 24 was 99% of GDP, the highest since World War II. By 2030, forecasted to be nearly 140% of GDP. We now spend more on interest payments than we do on the entirety of national defense. Last month, the national debt rose to over $36 trillion, and in 10 years, it's forecast to be $56 trillion. $36 trillion is over $100,000 for every single person in the United States. Think about what that means for benefits and services that seniors and vulnerable generations need right now. If we do not grapple with the national debt, the numbers never relent. They just don't go away. And that means it'll be even harder and harder to deal with it down the road. We'll have slower growth. You'll end up probably having more inflation and even higher interest rates. It's very easy, just takes a little self-discipline. All other parts of our economy have to live within that framework, local and state governments. Seniors will struggle, people with disabilities will suffer, and every generation will be worse off. Look forward to hearing about economic trends affecting seniors and Americans with disabilities, and I hope we keep our reckless spending problem front of mind in this discussion here today. Mr. Chairman, I yield back.
Thank you, Ranking Member Braun. Now we'll turn to our witness introductions, and I'll turn first to Ranking Member Braun for the first witness introduction.
Brent Orrell is a senior fellow at the American Enterprise Institute. Mr. Orrell specializes in job training and workforce development with a special focus on disadvantaged populations. He is also an expert on the impact of technological change in the workforce, which is rampant here in this day and age. Mr. Orrell previously held multiple roles in government, including at the Department of Labor and Health and Human Services. Thank you for testifying here today.
Thanks, Ranking Member Braun. I'll now turn to the remainder of our witnesses. Our first witness is Aaron Willman. Aaron is the founder and CEO of the White Cane Coffee Company in Warren, Pennsylvania, and I've been there. It's a great coffee company in northwestern Pennsylvania. Aaron started White Cane Coffee Company in 2019 to provide self-sustaining jobs for people with disabilities living in rural communities, including for herself and her brothers. So, Aaron, we're grateful you're here. Grateful you made the trip. Coming from Warren County is quite a ride. So we're grateful you took time to be with us. Our third witness is Lydia Brown. Lydia Brown is the Director of Policy at the National Disability Institute and an adjunct professor of disability studies at American University and Georgetown University. Counselor Brown's research focuses on economic security and wealth building for individuals with disabilities. Counselor Brown, we're grateful you're here today, and thanks for sharing your expertise with us. Our fourth witness is Mayor Neil McDevitt. Mayor McDevitt is the mayor of North Wales, Pennsylvania, in Montgomery County, in the southeastern corner of our state. So we have representation from the Northwest and the Southeast, all in one hearing. Mayor McDevitt was elected as mayor, I guess elected in 21 and started serving in 22, and is believed to be the first deaf mayor elected to a municipality in the United States of America. So, Mayor, thank you for being with us today and sharing your expertise and insight. And our fifth witness is someone I've known a long time, a great advocate, Ai-jen Poo. Ai-jen is the president of the National Domestic Workers Alliance. She is also co-founder and director of Caring Across Generations, a coalition of organizations working to strengthen the caregiving infrastructure for America's families. Aijen is a recognized expert in family and elder care and has been recognized by Time Magazine as one of the 100 most influential people in the world. Aijen, we're grateful you're here today and really have enjoyed working with you, and thank you for sharing your expertise with us. So we'll start with our first witness, Mr. Oro, for his testimony, and then we'll go right down the line from there.
Chairman Casey, Ranking Member Braun, other members of the committee, thank you so much for the opportunity to discuss the critical issues facing aging and disabled workers in America. I will focus on two dimensions: the practical demands of the economy and the moral responsibilities of our society. The largest factor shaping America's economic future is demographics. Our population is aging rapidly, with the fertility rate falling and the median age rising from 29 and a half years to 38.9 years since 1960. From 2000 to 2005, our workforce grew by 12 million workers. Between 2017 and 2022, that figure was just 1.7 million. Demographics drive growth. Older populations work and consume less, reducing economic dynamism. While we cannot quickly reverse population trends, we can engage marginalized groups, older workers, people with disability, people with criminal records, and others. To help sustain growth in a time of worker shortages, no individual's contributions can be overlooked or minimized. The second dimension, that of the moral, is that being American means believing in the dignity of every person. Work provides a vital way to express that dignity, aligning skills and interests with the needs of the economy and our fellow citizens. For older and disabled Americans, this is no less important. If we neglect to uphold and support their participation in the workforce, we will not only hurt our economy, but fail to uphold the core value that every human being is entitled to equality and dignity. The participation of older workers in the workforce has been rising steadily, with 19.2% of Americans age 65 or older now working or seeking work. In 2000, 25% of post-retirement age seniors were employed compared to 32% today. By 2032, older workers will make up 8.6% of the labor force compared to 6.6% in 2022. Similarly, the employment rate for individuals with disabilities reached 22.5% in 2023, and that's the highest since data collection began in 2008. However, this is still just 1/3 of the rate for workers without disabilities, and the employment rate for those with disabilities is twice as high as the general population. Many disabled workers face additional barriers, such as limited access to full-time jobs with benefits, and roughly half of disabled Americans are also over the age of 65, which compounds their difficulties in the labor market. Advances in artificial intelligence, automation, assistive technologies all offer opportunities to remove barriers and expand employment for individuals with disabilities. Screen readers, voice recognition software, and AI-powered communication tools enable individuals to perform tasks once inaccessible. For older workers, AI tools can simplify complex tasks, and telework platforms can allow them to remain at home and work from there. However, the benefits of technology will only be realized if we have an intentional design and policy support behind it. Policymakers should be looking at ways to make these technologies accessible and affordable. In terms of recommendations, we need to be promoting inclusive employment practices in the workplace. We need to invest in education and training to expand access to learning across the lifespan to help older adults and people with disabilities gain new skills. And we need to leverage technology for inclusion. I think this is an area that is ripe for public and private investment to adapt these new technologies to the needs of the elderly, or older workers, and people with disabilities. The challenges posed by our demographic shifts and gaps between work and older and disabled job seekers are formidable, but they are not insurmountable. By fostering workforce inclusion for older and disabled Americans, we can strengthen both our economy and our social commitment to dignity and equality. And together, we can build a labor market that reflects both our values and maximizes the potential of every person. Thank you so much for the opportunity to offer testimony.
Mr. Earl, thank you for your testimony. We'll turn next to Erin Woolman. Erin?
Hello, I'm Erin Willman. I am the founder and CEO of White Cane Coffee, and I would like to thank Senator Casey and Senator Braun, along with the rest of the members of the Aging Committee, for inviting me to speak on subjects that both I and many in the disabled community face. A lot has happened since I was here in February. I have received an incredible number of calls and emails from disabled persons and organizations that assist the blind and disabled. The common theme of those messages is that things are actually changing. We are not yet where we need to be when it comes to disability access and acceptance, but we are getting there. It brings me great joy when I hear of disabled people in my community getting good paying jobs and not being relegated to sheltered workshops for less than minimum wage. A few weeks ago, an engineer from a large manufacturer in our county visited our coffee factory to see how we adapted our workspaces and machinery to accommodate our employees. He honestly wants his company to be inclusive. I consider this a huge step forward. On a side note, I had the honor to run for PA State Representative for District 65. Even though I lost my election, I found the majority of people that I met were accepting of me as a viable candidate. The best part of the experience was having younger people come up to me and tell me that because of my running for office, they too feel that they can also create change in their community in both large and small ways. Today, I would like to talk about accessible education and how it can be bettered with the RISE Act. People ask me all the time if I went to college. The answer, I am sorry to say, is no. Despite the fact that I graduated high school at the age of 15, I felt wholly unprepared for the challenges that my disability would bring me in a college setting. However, my hope is that others in the disabled community won't feel that trepidation when they seek out higher education. But I recognize that there are things that need to be changed for that to happen. At this time, people with disabilities who wish to go to college and need accommodations to be successful have to prove that they are disabled through costly testing, even if they were born with a disability or have previous documentation from when they were in high school. I remember how nerve-wracking it was for those in my life who were heading off to college. I can't imagine putting more stress on a person with a disability because they have to prove their disability to get the support they need to thrive. If a person already has documentation that they are disabled, that should be sufficient. I don't believe that there are any prospective students who somehow became able-bodied would want to ask for the same assistance they had before when they were disabled. While proving that a person has a disability is disheartening enough, there's also the issue that many schools make it difficult to find out what sort of assistance and accommodations are available to disabled students. When looking into a college a student wants to attend, they have to comb through websites, visit the campus, and even in some cases, contact the administration personally just to find out if the school has the accommodations that they would need to access the education offered by the college. If one school does not have the accommodations a particular student needs, the student will have to repeat this search process as many times as needed until they can find a school that is suitable. Not only can that process be stressful, it can be so disheartening as to possibly turn them away from the idea of going to college at all. It doesn't have to be this way, though. If schools were upfront and transparent on what accommodations are available, the stress of finding the right school would be lessened significantly, making the transition to higher education easier. Now I believe it is time to give the spotlight to our educators. We've all had at one point in our lives had a teacher on who has inspired and helped us find our path in life. So I believe that they should have So I believe that they should have help to continue that work on a wider scale. It is an unfortunate truth that many teachers do not have the training that they need to accommodate a student with a disability. However, under the RISE Act, this is a problem with an easy solution. The RISE Act would allocate funds to college administration so that the faculty has the tools and know-how to be able to teach all of their students so that they are able to thrive in their classroom. By educating our educators, our colleges can be a place where everyone can succeed no matter what. I have always been extremely passionate about education. I believe that it can open doors and build bridges. It can lead to good jobs and a better life. Education expands a person's opportunities in life. It's why I work with so many schools for the disabled, so those students can create a brighter, more inclusive future. America is known as the land of opportunity. By implementing the RISE Act, many disabled people across the nation will have the opportunity to seek out higher education without the worry they would not belong. Something as simple as that would change their lives. If you change one life, you change the world. It is time to change the world. Thank you.
Ms. Willman, thank you for your testimony. Councilor Brown, you may begin.
Good morning. My name is Lydia Sinjun Jungsun Brown. I am Director of Public Policy at National Disability Institute, as well as a proudly disabled advocate. Thank you for the opportunity to provide testimony before the committee today. Disabled people represent at least 20% of the U.S. population, or more than 65 million people. Although the real number is likely higher than current surveys indicate, including people who have newly acquired disabilities due to long COVID. Our community faces deep economic disparities with poverty and unemployment rates for people with disabilities about twice those of non-disabled people, along with higher rates of homelessness and food insecurity. According to NDI's research, disabled people are more than twice as likely to be financially vulnerable as non-disabled people. Only 51% of working-age disabled adults are confident they can pay their bills on time, and 46% of disabled adults carry more debt than they can manage. Fewer women with disabilities, disabled people of color, and LGBTQ people with disabilities are financially healthy than people with disabilities who are men, white, or non-LGBTQ. Over 30% of disabled households have an income below $15,000, a rate 5.6 times higher than for households without a disability. And those numbers are substantially higher for Latinx and Black households with disabilities. These economic disparities in earnings, savings, banking, and wealth building are exacerbated for the many people with disabilities who rely on means-tested public benefits to survive. Many disabled people rely on Medicaid as the sole provider of long-term supports and services, help with eating, taking meds, getting dressed, even positioning their bodies. These services that can keep people in their own homes instead of nursing homes and institutions, as well as enable people to enter and remain in the mainstream workforce. Eligibility for Medicaid, however, is tied to eligibility for Supplemental Security Income, SSI. A beneficiary is prohibited from having more than $2,000 in countable assets if single, and $3,000 between both spouses if married, asset limits that were last updated in 1989. A person with a disability who wants to work and is able to work for any amount of hours is precluded from seeking the same array of opportunities as a non-disabled person if that disabled person relies on Medicaid-funded support to live at home or get to work. Some disabled people turn down promotions, hours increases, and raises in order to maintain eligibility for Medicaid because accepting the increased wages would not cover the gap if they lost their benefits. These asset limits can force people to choose between going without necessary medication or paying their light bills, or buying enough food, or making rent. An emergency bill of $2,100 a modest amount for some hospital stays, could leave a disabled person on SSI with no savings at all, and snowballing consequences of carrying the debt. 10 years ago, Senator Casey's leadership in introducing and passing the ABLE Act changed the game. People whose disabilities began before age 26 can now access a savings vehicle that can conserve up to $100,000 total without their savings counting against them in determining eligibility for SSI and for Medicaid. Money in an ABLE account can be used for a wide range of qualified disability expenses, including otherwise unaffordable assistive technology and healthcare, as well as educational and employment-related costs. For many disabled people on Medicaid, an ABLE account is also their only available means to save for retirement. In recent years, NDI also championed Senator Casey's leadership in passing multiple improvements to ABLE, including the ABLE Age Adjustment Act, which widened ABLE eligibility to people whose disabilities began by the age of 46, a provision that comes into effect a year from now and will ensure eligibility for more than 6.2 million additional people with disabilities, including 1 million veterans. As we look forward to the future of the ABLE program, we know there are many opportunities for further growth and improvement, especially to benefit the most impoverished people with disabilities who may not be able to make contributions to an ABLE account, and disabled people who are working and earning enough to make contributions in excess of the current $18,000 annual limit. Members of the Senate are currently considering a range of improvements for the ABLE program, all of which would greatly increase financial capability for people with disabilities. The ABLE Direct Deposit Act and the ABLE Employment Flexibility Act would codify common sense improvements, like allowing direct deposits and employer retirement contributions into an ABLE account. The ABLE Awareness Act, the ABLE Tomorrow Act, and the Enable Act would collectively support engagement and education efforts around ABLE to increase enrollment for eligible beneficiaries, protect against Medicaid clawbacks after a beneficiary's death, and allow one-time lump sum contributions over the annual limit. Language in these bills would also permanently adopt provisions allowing additional contributions to ABLE accounts for working people with disabilities, a saver's credit for ABLE contributions, and rollovers from 529 education savings accounts to ABLE accounts. Opportunities remain for increasing economic opportunity and participation for people with disabilities, who deserve to have the full range of financial choices and freedom as people without disabilities. Future legislative efforts can expand eligibility to more people with disabilities, protect rights of youth in the foster system and adults under guardianship, and increase disabled people's ability to save for retirement on par with non-disabled people. NDI believes in a future where all people, both disabled and non-disabled, can be assured of basic economic security and opportunity. This includes a future in which disabled workers can save for retirement on par with non-disabled workers, and disabled people have no ceiling on the amount of income they can earn and savings they can build, just like everyone else. Senator Casey, please know that you have made a difference. Thank you again today for the opportunity to speak before this committee. I urge you to continue championing policies that advance equity, financial inclusion, and economic opportunity for people with disabilities. Together, we can create a society where all people have the resources and opportunities to achieve financial stability and economic security.
Councilor Brown, thank you very much, and thanks to the work of NDI. Mayor McDevitt.
Good afternoon. As a resident of the Commonwealth of Pennsylvania, I am heartened to sit before Senators Casey and Fetterman on this special day. Ranking Member Braun and other members of the committee, thank you for welcoming me today. I sit before you today as the mayor of North Wales Borough, an amazing community of 3,400 residents in Montgomery County, just outside of Philadelphia. That may not be remarkable in itself. There are, after all, over 519,000 elected officials in the United States today. I am unique in that I am, as far as we're able to tell, the first deaf person to be elected to the office of mayor who uses American Sign Language as their primary means of communication. I am also a proud alum of Gallaudet University right here in Washington, D.C. As an elected official who uses American Sign Language and the first one in the Commonwealth of Pennsylvania, I found out very quickly where the barriers are. In a tiny community like North Wales, I'm blessed that the Borough Council and Borough Manager wisely had funds set aside in their budgets long before I was elected to ensure accommodations for people with disabilities. I know that this is fairly unique to small communities across the United States. The sad truth is that I don't have enough funds available to cover all of my interpreting needs, and I need to pick and choose where I spend those funds. Senator Casey, I shared the challenges I had with you and your staff. In your research, you also found another barrier that exists for people with disabilities who want to get involved in politics. That is, if a person with a disability simply runs for any office, be it paid, barely paid, or unpaid, they can lose their supplemental security income, SSI, or social security disability insurance income, SSDI, even if they don't raise any money or they lose their election. In two separate congressional sessions, Senator Casey presented two bills. The Removing Access Barriers to Running for Elected Office for People with Disabilities Act would address the discriminatory language in the Social Security Act that penalized people with disabilities for running for office. The second was the AID, Accessibility and Inclusion to Diversity Local Government Leadership Act of 2024 to address my challenge. That is, for small communities like North Wales Borough. It would establish a grant to reimburse those municipalities for accommodation expenses they incur for any elected and appointed officials with disabilities. These bills are a critical step towards addressing a glaring gap in the demographics of our elected officials. Out of the over 519,000 elected officials across the country, I am personally aware of only 5 who use American Sign Language nationally today. If our elected officials truly represented our populations, we'd have over 1,550 elected officials today using American Sign Language. Extending that further, current estimates say that 10% of all elected officials have a disability of some type, but 28.7% of the population has a disability. The unfortunate conclusion is that our elected officials are not representative of the people whom they serve. The reality is that the Americans with Disabilities Act, ADA, is the last great civil rights bill that was passed with true bipartisan support. As I said during my remarks at the White House's Disability Pride event a few months ago, I woke up one morning with rights I did not go to bed with. The ADA made millions of Americans first-class citizens in our own communities overnight. In the 34 years since the ADA was passed, our political will towards safeguarding these vital human and civil rights have weakened significantly. I call on congressional leadership and senators from both parties to recommit to protecting these vital rights and services for millions of Americans. I ask you to look beyond the rhetoric of soundbite politics and listen carefully to the people who would actually be affected by the policies that have been suggested or proposed by members of the incoming administration. The next Congress can take positive and proactive steps towards ensuring the civil and human rights of people with disabilities. First, the passage of Senator Casey's bills referenced earlier would be an excellent first step towards ensuring that our elected officials are truly representative of the communities whom they serve. Congress must also ensure that all United States citizens are able to freely participate in every American experience. This requires full funding and dedication of the U.S. Department of Justice's Civil Rights Division to work closely with municipalities and counties to ensure that all Americans have full access to vote and to take part in their communities. Senator Casey, You have been a steadfast ally of North Wales Borough, the Commonwealth of Pennsylvania, and millions of disabled and deaf Americans. We owe you a debt that can never be repaid. Thank you.
Mayor, thanks very much. I really appreciate you being here with us. Ai-jen Poo. Thank you, Ai-jen.
Chairman Casey, Ranking Member Braun, and members of the committee, thank you for the opportunity to testify this morning. My name is Ai-jen Poo, and I'm the president of the National Domestic Workers Alliance and executive director of Caring Across Generations. We are proud members of Care Can't Wait, a national coalition working to create good care jobs and guarantee affordable care for all who need it. I represent the family caregivers and the care workers who are struggling within an anemic patchwork system to provide essential support to disabled people and older adults. In the United States, federal Medicaid dollars, not Medicare, Medicaid, pay for the vast majority of long-term care, including wages for direct care workers. But Medicaid long-term care programs suffer from persistent gross underinvestment. As a result, over 710,000 people remain on waiting lists for Medicaid home and community-based services, or HCBS. Unpaid family caregivers and underpaid care workers are left to fill the gaps. Unpaid caregiving is worth more than $1 trillion per year. Direct care workers, who are majority women of color and immigrants, earn an average of just $25,000 per year. Nearly half rely on public assistance to make ends meet, and the workers, therefore, that we are counting on to care for us cannot care for themselves or their own families on the wages they earn. Many are forced to leave these jobs for fast food or retail jobs where they can earn more, increasing training and turnover costs for employers, impacting the quality of care for families, and feeding a workforce crisis that exists in states across the nation. But thankfully, there are solutions. The American Rescue Plan Act resulted in over $36 billion in investments towards Medicaid home and community-based services and higher wages for direct care workers. All 50 states took this funding because of the urgent need for care in every state. But this funding is short-term, set to expire in March of 2025, leaving the system vulnerable at precisely the time when we need more access to services, not less. Every day in America, 10,000 of us turn 65, and we're living longer than ever before. The number of adults over the age of 85 is expected to double by the year 2040. We will need a thriving direct care workforce to help meet the demand. Care jobs already consistently rank among the largest and fastest growing occupations in the entire economy because of the overwhelming need. Here again, we have solutions. We can invest in raising wages and supporting workers' rights to join a union and negotiate collectively for better wages and benefits. We know this works. And there's enormous return on this investment, not only in the dignity for the workers and the people who rely on their services, but the economic opportunity they enable, both for disabled people and working family caregivers who need care in order to work. Or in Senator Casey's words, some of us need a bridge or a tunnel to get to work, and others need care. But this is all out of reach without increasing federal funding for Medicaid. It is shocking that the discussion has returned once again to cutting Medicaid at the exact moment when we should be investing in it. Reductions in Medicaid funding will heighten the workforce crisis, the care crisis, push higher costs onto states that can't afford it. States will be forced to cut services and limit eligibility, which will literally put millions of lives at risk. Instead of cuts, we should be passing policies like the HCBS Access Act, the Better Care, Better Jobs Act, the Long-Term Care Workforce Support Act, the HCBS Relief Act to support freedom, dignity, and security of disabled people and really of all of us. These bills all share one sponsor, Senator Bob Casey. So in closing, I want to thank you, Senator Casey. You are a generational leader on these generational challenges that we face as a nation. Millions of lives have been improved because of your leadership and hard work. This arena of policy and the advocates who work on them, who have filled this hearing room this morning, are exponentially stronger because of you. While it is daunting to face the challenges ahead without you at the helm, we are determined to carry the torch forward. Truly, thank you, Senator.
Well, Agent, thank you so much for those words and for your leadership and your ever-determined and effective advocacy. And we'll get to our questions now. Senator Gillibrand, I've been instructed to yield to you if you want to start.
Mr. Chairman, I hope no one instructed you to do anything. But I really think this hearing is such a testament to who you are and what service you've provided for this community your whole public career. And I have personally admired having you as my chairman and watching you and seeing how you've led this committee on such important issues. It is a true honor and privilege to get to serve with you. And I think I speak for the entire community that benefits from this committee and your work that we are eternally grateful. I'm very excited that we have this panel of witnesses today. Each of you contributes so much to the conversation that we're having and so much to the solutions that this committee is trying to put forward. I've been very proud to work on and lead the Domestic Workers Bill of Rights Act with my colleague, Senator Casey. It ensures that workers caring for our families are respected, are protected, and are compensated fairly for the vital work that they do every day for our families and our communities. Ms. Pooh, what should we know about how the Domestic Workers Bill of Rights strengthens the paid care workforce and helps support family caregivers? What change and improvement for people with disabilities could we expect to see if it was actually enacted?
Thank you so much for your leadership and for this question, Senator Gillibrand. It's nice to see you. The Domestic Workers Bill of Rights Act will ensure the care workforce is treated like other workers in our economy with access to a safe workplace, sick leave, overtime pay, and protection from discrimination and harassment. A standards board will allow employers, enforcement agencies, and workers to work together to improve conditions, which will help secure the workforce that then supports disabled people and family caregivers, people who need the supports and the services. Family caregivers also support this bill because they recognize that a protected care workforce is really the backbone of the economy, and that care work is the work that makes all other work possible. We must ensure that these jobs are quality jobs, and many domestic workers are also disabled. So this is about opportunity and security for all of us.
Thank you so much. Working age adults with disabilities remain employed at less than half the rate of people without disabilities and are twice as likely to live in poverty. We have to do much more to support employers and workplaces that have made employment truly accessible and inclusive for people with disabilities. Ms. Willman, what are the biggest obstacles you faced founding the White Cane Coffee Company, and what about operating it now?
I think some of the hardest things that we faced when we first opened up White Cane Coffee is sort of getting the word out, having people take us seriously as a company. Many people saw us as the cute little coffee shop run by a blind girl. I am a serious businesswoman, and I wanted to make that clear. I don't want to be just the best blind business owner. I just want to be the best. And so we have strive for that every day. I have won international awards, and I am very proud of that. And even more so, I am proud of my work staff for helping me achieve these goals.
How can we help entrepreneurs who want to start businesses like yours, Ms. Willman?
I think what we need to do is, again, treat them like people and support them in every way we can. And with having the RISE Act implemented, it will have people be more educated to be able to start their own businesses. And also, if we, I've lost the word. If we implement apprenticeships more often, more students will be able to have firsthand work, and so that whenever they go to start their own job, they can feel a sense of confidence.
Thank you. Mr. Orell, this is something we obviously want to work on a bipartisan basis. And I know that there could be also some tax policies that could help businesses like the White Cane Coffee Company to be able to empower their employees with disabilities to live full, independent lives. I also have met many people with disabilities who had sponsors to help them do their jobs in the workplace and to be an advocate within the workplace for them to make sure that they can work at their fullest capabilities. So, Mr. Orell, what do you think on those topics?
Pardon me. Thank you for the question. I think that we need to focus on the incentive side of the equation, which is how can we support businesses in making this transition. We need, whether it's redesigning jobs, redesigning workplaces, or some other kinds of investments in bringing more disabled people into the workforce. I think that's far more effective than than trying to impose a mandate on employers. I think that actually is counterproductive. It builds resistance. What we need to do is to show business people that with a combination of the talent that disabled people have and the support that they can get through tax incentives and other incentives, that it's a good business decision for them.
Thank you, Senator Gillibrand. We'll turn next to Senator Scott.
Thank you. Thank you, Chairman. First, I want to thank everybody for being here. First, Chairman Casey and Ranking Member Braun, thank you for your service. Chairman Casey, it's been great to work with you over the past 6 years as you highlight the needs of older Americans. I want to thank you for your hard work over the last couple of years in these committee meetings. I know it's a lot of work, and you've done a great job. Ranking Member Braun, I'm proud to have the opportunity to call you a friend and a partner on so many things to help make Washington work for the American people. We came up at the same time. You're going to be a great governor. You're going to do a great job. I'll do everything I can to help you become the #1 governor in the country. We're top co-sponsors of each other's legislation. Over the past 6 years, time we've both been up here, I've joined 71 pieces of legislation from your office, and you've joined 67 from mine. For both of you, I look forward to watching what you do with your post-Senate careers. I know what Senator Braun's going to do, and Senator Casey, I wish you the best of luck. Everyone in the United States, regardless of disability, deserves to have a chance at the American dream. Overregulation and outdated laws inhibiting this need to be reviewed, cut, and rewritten. For example, as of today, individuals who are in the Supplemental Security Income program can only have $2,000 in assets, with couples only allowed $3,000 jointly. This law hasn't been updated in decades and is hurting everyday Americans. It's time for a change. I'm proud to join my colleagues in supporting the SSI Savings Penalty Elimination Act to encourage financial stability for individuals in the SSI program. Individuals with disabilities shouldn't be held back from receiving their federal benefits due to the government not being compliant with federal accessibility laws. In 2022, the Washington Post issued an alarming report that blind and disabled veterans can't properly access VA websites. That's wrong. Last year, Chairman Casey and I introduced the Veterans Accessibility Act to address this issue. I'm happy to continue this fight in the next Congress to make some meaningful reforms and help our veterans with disabilities. Mr. Orwell, how can we ensure that reforms to SSI encourage work and independence rather than perpetuating dependency?
I think the good news is that we are seeing in the economy, given how robust it has been, significant improvements in workforce participation. Some of those people probably in the past might have wound up on disability payments. So, and this is something that Senator Braun addressed in his opening statement, which is the most important factor in keeping people from becoming dependent is a robust economy that pulls people into the workforce. I do think that there's a need to address the incentives within these disability programs so that the first thing that we're thinking about is employment, and then we think about whether that person can benefit from access to Social Security Disability Income, SSI, and other programs, veterans benefits, and so on, so that we have all of the arrows kind of pointed in the right direction. Work should be the default, and access to benefit programs should be the exception. I don't want to see anybody who needs benefits denied, but I do think that we have had a history in the last several years, or decades really, of using these disability programs to warehouse people. And I think that's wrong. It's bad for the economy, it's bad for the people, and it's something that we really need to revisit across the board in disability programs.
What would be your number one market-based solution to help people that have disabilities?
I think that we have to recognize that mandating higher wages, mandating inclusion policies that require certain numbers of people with disabilities have the effect of making access to jobs more difficult for people with disabilities. So I think we need to, in some ways, it's things that we should try to avoid doing if we can, to avoid the disincentives toward work.
Ms. Woolman, I look forward to coming to your coffee shop someday. How would raising the SSI asset limit impact the ability of individuals with disabilities to start and grow their businesses?
I believe that they would be less afraid to make the steps that they need to make. It takes a lot to start a business, and to have enough assets will likely exceed the SSI cap. So if that is changed, more people with disabilities would be able to start their own businesses.
Thank you. Thank you, Chairman. Thank you, Ranking Member.
Thank you, Senator Scott. As many of those who attend our hearings know, senators are in and out. Some coming to ask questions, some here for a period of time and have to leave for other committee hearings, other commitments on a Thursday. So we'll have some senators who will be here for questions and some who won't. I know earlier we had both Senator Blumenthal and Senator Kelly here, and we're expecting more senators in just a little while. I'll start my questions, and then I'll turn to Ranking Member Braun, and we'll see where we are with other senators coming in and out. I wanted to direct this question to both Ai-jen Poo and Councilor Brown. As the panel noted, people with disabilities represent at least 20% of the U.S. population, or more than 65 million people. I think most experts believe that number might be an undercount, but that's roughly the number that most people point to. It's been 34 years since we passed the so-called ADA, the Americans with Disabilities Act. Yet every day people with disabilities continue to face barriers. We hear about this all the time. Barriers in making a living wage, barriers to building wealth, barriers to accessing higher education, as Aaron Willman outlined, and of course, barriers to securing home and community-based services. So it is those barriers that continue to be the subject of a lot of our work and will continue to be part of the challenges ahead of us and ahead of the next Senate, the next administration, and I'm sure many after that. Despite the many advances that have been made to security, equal opportunity for people with disabilities, there's still so much more that we have to do. And I wanted to ask both Councilor Brown and Ai-jen Poo, with an eye towards the next Congress and the next administration, what disability policy do you think is the most important to address? And I know you might have a list, and that's okay, but if you could just itemize and maybe prioritize.
This is Lydia speaking. Most importantly, for many people with disabilities, we need to continue to have access to and increase support for home and community-based services. These are services that are available and funded through Medicaid. And I am echoing some of what Ai-jen shared a few minutes ago during her testimony. People with disabilities rely upon those services in order to access employment, to enter the workforce, to stay in the workforce, to grow their earnings, and ultimately to grow their savings and to maintain participation in the mainstream economy. Over the last year, we know that employment for disabled people, we've calculated, is up 30%. That is a dramatic and important increase for people with disabilities. With the right supports in place, people with disabilities are able to work in ways that support their bodies and minds. We are able to participate in the workplace. We want to participate in the workplace in ways that work for us, and ensuring that continued funding and increasing levels appropriately for Medicaid will guarantee that that can continue to happen. We also know that now, the ABLE program, which has allowed many more people with disabilities to continue benefiting from Medicaid, has resulted in $2 billion. That's billion with a B, just to clarify that, billion with a B, $2 billion saved through ABLE. There are 187,000 ABLE accounts currently open. That's an average of $11,000 per account right now. Obviously, individual accounts might have greater or fewer assets in them. However, we do know that these provisions allow people with disabilities to get jobs, to keep those jobs, to save money, build their wealth for the future, and have a financial future.
I will just simply build on Councilor Brown's thoughts here and say, I would like for Congress to prioritize your legislation, the Better Care, Better Jobs Act. Breakthrough in that legislation is the knitting together of investments in services and the workforce, which are truly interdependent investments. You cannot have more access to services without a strong workforce in place. And without a strong workforce, it is really, there is no foundation for home and community-based services. So we were so grateful to have this legislation introduced, and the momentum that it has gained in the last few years is extraordinary. And I really hope that Congress will take this up. And in any case, we should not be entertaining cuts to Medicaid. 80 million people rely on Medicaid for health care and essential services. Millions of families rely on Medicaid home and community-based services. If there are threats to Medicaid, lives will be at stake. And we cannot afford that in this country. It is not acceptable. And we just hope that this next Congress will protect Medicaid and strengthen Medicaid and invest in Medicaid home and community-based services.
Well, Ai-jen, I wanted to emphasize what you just said, both the importance of advancing Home and Community-Based Services legislation, the Better Care, Better Jobs Act. It's better that you said it first than I said it for the next Congress, the next administration. But I thought it was also noteworthy and significant, as well as you emphasized, not cutting Medicaid, which it would be, in a word, catastrophic for the country, and it really beyond catastrophic for the most vulnerable. But you also said on page 2 of your testimony the following: the American Rescue Plan Act. The American Rescue Plan Act resulted in over $36 billion to expand access to Medicaid home and community-based services and raise wages for direct care workers. And then you put in bold, all caps, all 50 states took this funding because of the extensive need for care across the country. I emphasize those words from your testimony because this is no longer in the realm of theory. We have data now that every state has embraced this, at least to begin to erect a kind of foundation for home and community-based services that does not exist in the United States of America. So this great country that we are doesn't allow the choice for an individual, either a senior or a person with a disability, to make the choice to say, I want to have care in my home. I have a disability. I want to be able to stay in the community. I don't want to be consigned only to an institutional setting. A lot of great nursing homes out there. Most do a really good job. But an American ought to have a choice. Ought to have a choice about where they get their care, where they live. It's basic to our dignity and our sense of who we are. But I think it was noteworthy that the American Rescue Plan, which was not bipartisan, but when the dollars were available, all 50 states embraced it, because not because they had nothing else to do or had some philosophical agreement with those of us who are advancing this idea. They embraced the dollars because their constituents, Democrats, Republicans, independents, people they represent in these states are telling them, we want this. This is what we deserve as Americans. And I think any public official who just throws up their hands and says, oh, well, we can't do that, it's too complicated, is going to find out that there are going to be people coming through their front door to demand this. And they should demand it. And we should, at the federal level, be instrumental in helping them. So that's all. I went a little longer there. It's the last hearing. So, Senator Braun?
You're entitled to that, I think. Thank you. Mr. Orell, when we put all the resources to significant issues like this, and in my opening statement talked about the general economy, which, we've had record inflation over the last 3 to 4 years. The federal government has grown to like 25% of our GDP. It's never been 20% before. So resources, all of them borrowed, to kind of put us into those stats there. I'm curious, have more disabled individuals come into employment? So we can see what's happened there. What can you tell us about, has it worked, or have the negative consequences of higher inflation, higher debt, some would say a robust economy through government, but not in the real economy? What can we see with real stats there? Has it worked?
So I would say that it's very important in this to look across the entire federal budget. The resources going into disability programs can be very significant, maybe $450 billion between SSI, SSDI, VA, Medicare and Medicaid. It's a lot of money. We are spending about $4 trillion on regular Medicare, Medicaid, and the Affordable Care Act programs. So it gives us some sense of the proportions that need to be addressed. I don't think there's a one measure solution to the budget deficit. I think we've got a big problem across the federal budget, and there are certainly bigger targets than disability that we need to address, but disability needs to be part of the mix. I would say for the long-term well-being of disabled people and the economy, or disabled people, what they need most is a strong economy. This isn't an option. Like, it would be nice to have, it's great, it's important to have the programs, and it'd be nice to have a strong economy. A strong economy is the most important protective factor for people with disabilities because it creates the revenues that makes it possible to provide the services that people with disabilities need, and it pulls them into the workforce. It enhances their dignity as individuals to be able to access employment. A hot economy does that. It does that better than anything else we can do.
So better than what government would be able to do through directing resources, even particularly at the problem.
So let me say this. I have a son with autism who has benefited greatly from public services in our school system in Northern Virginia. He's now enrolled in a vocational training course run by the state of Virginia. I had a granddaughter, she passed away, who was severely disabled, and we needed round-the-clock nursing coverage for her. I do not diminish the importance of these programs at all. They do make a big contribution to the well-being of our citizens. The question is, do we have people on these benefit programs that would be better off with accommodations and supports that would allow them to work? We need their work. This isn't strictly altruism. We have an extremely tight labor market. We need to get more out of that labor market.
And then, has there been a measurement over the last 4 years? Have more disabled people come into the workforce significantly? Has it been flat, or has it gone the other way?
I would say over the last decade, we've seen significant improvement in people working and getting disabled people moving into the workforce.
And any observation over the last 4 years where we've had dramatic inflation and the economy has been government-driven as opposed to private sector-driven?
I would say the evidence is mixed. We have seen a reduction in the number of people on disability that was driven by some regulatory changes about how we assess disability. Some of that reduction was due to people aging out of disability programs. Okay. So it's not exactly clear, the answer to the question, but we do know wage inequality has declined because of very strong employment market. We've got more people with disabilities in the workforce. And I think what that says to me is that a strong economy is the best, is the single most important aspect of what we need to be doing for people with disabilities.
One other question.
Yeah.
In terms of the responsibility between the federal government and states, I'm going back to set the agenda, run a state. Generally, they work within balanced budgets. What's your opinion of how much of the responsibility should be done here versus there, and which would be more effective and use the resources more efficiently?
I'm a big believer across federal programming that we need to devolve as much responsibility and authority over these programs out of Washington and into the states. The states have a much better handle on the needs of their communities, the needs of the individuals living in those communities. I think that they need to be in charge as much as possible in the administration of these programs. The federal government's main role here, I think, is providing a baseline set of resources that could be that is administered by the states. So across the board, this isn't just disability. I think in workforce programs, it's the challenge. States, governors, local business communities, they know what's needed, and they need to be empowered to make those decisions.
Thank you.
Thank you, Ranking Member Braun. We'll turn next to Senator Warren.
Thank you, Mr. Chairman. Senator Casey has been a tireless champion for American families. As chair of the Aging Committee, he has been right at the center of fights for rights for Americans with disabilities, lowering the cost of child care and elder care, and raising wages for workers. Megan Luskowski, a caregiver and disability advocate from Philadelphia, put it this way: Senator Bob Casey opened his eyes to our families and saw the needs of our children. He opened his ears and listened to our lived experience. He opened his heart and genuinely cared about improving our children's situation. And as Senator of Pennsylvania, time and time again, he opened his mouth to fight for our kids' access to care and to their community. It will always be scary sending a disabled child out into the world, but with Senator Casey representing us, we could rest assured knowing that they had a champion in Washington. I ask that this statement regarding the chairman's work be entered in its entirety into the record.
Without objection.
Thank you. American families need Congress to continue building on Senator Casey's legacy. But instead, the big ticket agenda item for Republicans next year is a $4.5 trillion extension of the Trump tax cuts, mostly for billionaires and billionaire corporations. Now, what could $4.5 trillion buy us instead? Well, we could restore the expanded child tax credit and the child and dependent care tax credit that Senator Casey helped pass in the American Rescue Plan to put more money into the pockets of working families. We could make home care for seniors and people with disabilities more affordable, as Senator Casey has championed. We could pass paid leave for every worker so that no one has to choose between a paycheck or caring for a loved one who needs help. And we could guarantee affordable child care for every family in America. Now, I listened as Senator Braun and Mr. Orell talk about how to build a strong economy. So I want to pose that same question. I just want to do it slightly differently. Ms. Pooh, you are president of the National Domestic Workers Alliance. That means that you represent 2.5 million domestic workers. If we're going to spend $4.5 trillion, I just want to know which is the better investment in our economy overall. This is not about for individuals, it's just what's going to make the economy work better. Is it lowering costs for families and raising wages for care workers on the one hand, or another tax giveaway largely sucked up by millionaires, billionaires, and giant corporations? Which is going to promote our economy more?
Senator Warren, thank you so much for that question. I should hope that if we are going to spend $4.5 trillion, that we're going to spend it on the needs of everyday American families. The cost of care in this country is astronomical. Child care for 2 children costs more than rent in every state in America. The lack of paid leave costs Americans $22 billion annually, and the cost of aging and disability care at home costs between $62,000 and $280,000 per year. Instead of more handouts to billionaires and corporations, we can afford to ensure every child has access to high-quality early childhood education. Every worker in the U.S. has paid leave, as you said. We can raise wages for hard-working American families. That seems like the better return on investment.
Yeah. So I very much appreciate your underscoring this point. You know, the reminder that when we raise wages for caregivers, That means there are more caregivers available. More people will go in, more people will stay in. More people will make this a part of their careers. And what does that mean? There are more people who have other jobs that will be able to go to those jobs. You know, I think of this as the double investment.
Yes.
The investment that is the right investment for those who need the care and the families that are struggling to give it, but also the investment, if we want more workers in our economy, one of the ways we get more workers in our economy is to have care for those who need care at home. President Trump and Republicans in Congress have been clear that their plans to pay for the next tax giveaway to billionaires and billionaire corporations is to slash investments that actually grow our economy and support these good jobs. They plan to cut programs like Social Security. They're planning higher taxes on everyday items that families buy, like groceries and gas. Next year's tax fight will be an opportunity to show the American people whose side they are on, the side of billionaires who are clamoring for more handouts, or on the side of hardworking Americans. Chairman Casey, I know which side you are on. I just want to say thank you for your leadership, for your determination, and for everything that you have done for American families. It is an honor to fight alongside you.
Senator Warren, thanks so much for your comments and also for the great advocacy that you undertake every day on behalf of the people of that other Commonwealth of Massachusetts and the American people, and especially American families. I'm so grateful for your work, and we'll miss working with you.
Thank you.
Senator Warnock.
Thank you so very much, Chair Casey. I just want to echo the sentiments of Senator Warren and so many others, and take this opportunity to thank you so very much for your fine leadership in the Senate and on this committee. Certainly on behalf of Pennsylvanians, but also on behalf of Georgians, on behalf of the American people. You have been a dedicated public servant in the tradition of your family, centering the most marginalized members of the human family, the disabled, the elderly, the poor. And in just the 4 years that I've served on this committee, you've improved access to health care, you've strengthened protections for seniors, you've centered people with disabilities so that all Americans can survive, can thrive, and we can have an economy that serves the whole country. So thank you so much, and I look forward to continuing the great work on this committee. Nearly 15 years after the passage of the Affordable Care Act, 10 states, including, sadly, my state of Georgia, have not fully expanded Medicaid. Georgia has the dubious distinction, in fact, of being the only state in the country that currently requires low-income folks to jump through bureaucratic paperwork hoops in order to satisfy work requirements to access Medicaid. Mm-hmm. So let me underscore that they want you to jump through these bureaucratic hoops to get health care, rather than recognizing that a baseline of health care is necessary to have a strong workforce. It's been a drag on the Georgia economy, to be sure. Ms. Pooh, how do Medicaid work requirements, in your view, affect people with disabilities?
Senator Warnock, Medicaid work requirements in general quite simply do not work. The vast majority of Medicaid enrollees are working.
Right.
Period. The remaining enrollees are family caregivers, students, disabled people who may not be working for very legitimate reasons, including lack of access to caregiving services. Work requirements are also administratively so burdensome, as you referred to. States spend millions of dollars to set up systems to manage work requirements. Meanwhile, disabled people are particularly harmed by Medicaid work requirements because of the lack of accessible formats for work reporting in state systems, barriers to receiving reasonable accommodations in order to work, employment discrimination, and the high burden of proof to qualify as disabled. Instituting work requirements means disabled people, family caregivers, direct care workers who provide critical care disabled people and older adults need get caught in red tape, lose their health insurance, and suffer, all while costing state budgets millions in administrative costs that should simply just be going towards making sure people have health care.
Yep. And, you know, I appreciate your clarifying the consequences of these political talking points that folks make, because that's what it is. It's not reality. It's talking points. And I'll give you another example from Georgia. There was a young woman whom I had the honor of meeting. Her name is Heather. Heather is a traveling nurse from Dalton, Georgia, and she falls in the Medicaid coverage gap that unfortunately we still have in Georgia. I brought her with me as my guest for the State of the Union address, and I've been dealing with addressing this Medicaid gap since long before I came to the Senate. After experiencing a series of small strokes that left her unable to work full-time, Heather started the very lengthy process of applying for Social Security Disability Insurance, SSI, which would allow her to automatically qualify for Medicaid while she waits for a decision on whether she meets the strict requirements of SSI. Heather, who is a nurse, who dedicated her life to caring for patients, ironically can't afford to pay for her own medical care out of pocket because she doesn't have enough to qualify for subsidies to buy private insurance. It's a tragic irony. It's a woman who spent her life attending to other people's health care needs, and she's stuck in the health care gap in Georgia. Ms. Pooh, should we be making it easier or harder for folks with disabilities, like Heather, to access affordable health care, and why?
Senator, we should always be making it easier for people to access health care. For millions of disabled people with high health needs, Medicaid is a critical lifeline to care that prevents unnecessary hospitalizations, improves health outcomes, and helps bring people who can work into the workforce. People with disabilities cannot afford cuts to Medicaid, and let me be clear that work requirements equate to massive cuts to the program that would lead to less services for health care and care in the home. In Georgia alone, more than 7,000 people are already on waiting lists for Medicaid home and community-based services they depend on for their very basic needs. We have the opportunity to invest in Medicaid and ensure that more people can have access to health care and the aging and disability care in the community they deserve.
And just so it's clear to the folks who are listening, non-elderly adult caregivers who make under 100% of the federal poverty level, are they eligible for Medicaid in Georgia?
No, they are not.
Caregiving is not a qualifying activity for the work requirement. Is that correct?
That is correct.
So thank you for your advocacy. Again, Senator Casey, thank you for your incredible work on this and so many other issues. I could say so much about Bob Casey, but it's better said really by his own constituents. And if he would just give me a moment as chair, the following testimonial is from Anna, a mother and an advocate from Hanover, Pennsylvania. She said, I brought my children to meet Senator Casey in his office in D.C. in the summer of 2017. I wanted him to hear our story. I wanted him to understand what Medicaid had done for our family, how it lifted us out of poverty and saved us from losing our home. She said, I quickly learned that Senator Casey already had a deep understanding of the positive impacts of Medicaid. He listened intently to our story, and that day he became connected to our family. When speaking of Senator Casey, I always tell people, she said, he's the real deal. He truly cares about his constituents. He remembers their names. He remembers their stories. Please know that your absence in the Senate will be mourned by both the disabled and able-bodied people, not only of Pennsylvania, but of Georgia, people all across the country. Thank you for representing us so well. Thank you for your service to all of us. I ask that this statement regarding the chairman's work be entered, if the chairman does not object, in its entirety into the record.
Without objection. Thank you, Senator Warnock, for referencing a constituent of mine. So many of them that you've worked with and I've worked with in our states to take on these battles, to be advocates, sometimes against long odds, and to stop the kind of cuts that were presented in those days, but will be likely part of the dialogue next year. So I know you'll be in that fight. Thank you, Senator. Appreciate it. I just have a couple more questions. I wanted to get to a question earlier to Aaron Willman about subminimum wage. Aaron, you shared in your testimony how you started the White Cane Coffee Company because of lack of job opportunities that you and your brothers faced as people with disabilities. You made it a priority to pay your employees a fair wage and to provide high-quality jobs. Unfortunately, that's not the case for all employers. The Department of Labor has recently announced a proposed rule to phase out subminimum wages to workers with disabilities, but we all know that more work needs to be done to make this goal a reality. I have bipartisan legislation to do that, and we're working even in these last number of days of the year and of my time in the Senate to pass that. But Aaron, I wanted to ask you, what advice would you give to employers, because you are one, and to people with disabilities about how to ensure full, equitable access to both fair wages and high-quality jobs?
Thank you, Senator Casey. I think that employers should really do their research to see what benefits they can find to help be able to pay their employees a proper wage. It is difficult out here for us, and so we are doing our best. And for the employees, they should know their worth and know that what they put into the job, they will get out of it, especially if you find a job that does pay a livable wage.
Well, your testimony is especially significant and compelling because you see these issues from the perspective of someone who lives with a disability and also someone who has been an employer and a successful employer and an employer of people with disabilities. So we're grateful for that perspective. Mayor McDevitt, I wanted to ask you a question about the issues you raised about running for elected office, which I have done, not with the challenges and barriers that you faced. And I wanted to thank you for sharing your story. You've shared with me and with our colleagues the challenges you faced as a person with disabilities running for elected office and the lack of funding for reasonable accommodations for elected officials with disabilities to perform their duties once they're elected. You were the inspiration for a bill that I introduced called the Accessibility and Inclusion to Diversity Local Government Leadership Act, in which you made reference to. However, there is a lot more work to do to ensure that people with disabilities are represented in all levels of office. Mr. Mayor, as we look to the future, what can we do to help reduce barriers for people with disabilities to run for and serve in public office?
Thank you, Senator Casey. As I mentioned, the bill that you introduced, the AID Act, the Accessibility and Inclusion for Diversity Local Governance Leadership Act, would be a huge step in the right direction because it would remove the cost of accommodations for anyone who wishes to run or campaign. Today now, for example, it feels like open season. Any issue can become politicized. So by removing the cost of accommodations from the discussion, we can focus on the person's abilities, their ability to represent people in their community. One wonderful example of this, in the past, with Senator Fetterman's election, people questioned his ability to represent the state, the Commonwealth of Pennsylvania, because the accommodations became an issue. That should not have been an issue. It should not have been for discussion. Local governments are probably the most accessible place for people to start in terms of the political field. So your act would ensure that all politicians of both parties would be welcome to the table. And that would be a key first step.
Thank you very much, and thanks for being both an advocate and a model for those who would seek to run for public office with a disability. We're grateful for that. And of course, that inspiration has spread, I think, at least across our state, and I'm sure well beyond, because of course, Erin ran for state representative, and we're grateful that she took on that challenge. And Erin, if I know anything about politics, you can run again. So don't let that be your last election after you make a lot of money in that coffee company. But I wanted to close. Ai-jen, I wanted to see if there's anything else you wanted to add to the record, or anyone else for that matter. If you have anything else you wanted, you can certainly add written statements to the record that would amplify or add to your testimony.
Mr. Chairman, before I end my time, I would like to take a moment to read a message from one of your Pennsylvania constituents. It's a statement from Dr. Amy Houtrow, physician and disability advocate from Pittsburgh, Pennsylvania, the city where I was born, actually. In the disability justice movement, you often hear the rallying cry, "Nothing about us without us." Senator Casey has taken this to heart and brings people with disabilities to the table. Make sure they have a seat at that table and a voice that is heard and respected. In a world where people with disabilities are marginalized, disregarded, dehumanized, and discarded, Senator Casey has used his authority, time, and efforts to elevate issues faced by disabled people. Pennsylvanians, especially disabled Pennsylvanians, and all disabled Americans have a champion in Senator Casey. I know that even after his Senate term ends, we still will. I ask that the statement regarding the chairman's work be entered in its entirety into the record.
Without objection, again, Ai-jen, thank you for reading that into the record in this last hearing. I'm reminded, I was sitting here in an aging committee hearing back about, gosh, it must be a decade ago now, more than a decade, 12 years ago. The chairman of the aging committee then was Herb Cole from Wisconsin. And Herb was a pretty low-key person, and apparently before the hearing he instructed everyone not to make statements that would be laudatory of the chairman, and they did it anyway. So I know now what he was feeling, what he was thinking at that moment. But I'm so grateful for those statements about my service and in particular the service of those who have served with me on my staff and for purposes of today, especially the Aging Committee staff, which I'll make reference to in a moment. But because of time, we do have to wrap up, and I will, there may be more questions for the record that we'll submit for our witnesses. But I do want to start by thanking our witnesses for their testimony and the unique expertise that they bring to a hearing like this, both expertise that has its origin in their academic work, their work as advocates or researchers or experts in the field, but also that they bring to bear their own personal experience when they come to testify at this hearing and hearings like that we've had in the Aging Committee. So we're grateful for that. We're grateful for their testimony. We know that based upon what we've heard today, there's a lot more work that must be done to protect the lives of and the rights of individuals with disabilities, whether it's living wages or wealth building, access to higher education, accessible technology, home and community-based services, and accessibility to ensure civic participation. These are just a few, not an exhaustive list, of the many issues that people with disabilities face every day. As Ai-jen Poo just made reference to, there's a constant refrain in the over the years from the disability community: nothing about us without us. My job as chairman of this committee has never been to speak on behalf of seniors or on behalf of people with disabilities or the disability community. My job has been instead to be an advocate, as best I could do it, to be an advocate and to work as chairman to raise up the voices of both older Americans and people with disabilities. As I said in my opening statement, and we've heard from our witnesses, this work is not done. There's a lot more work to do. We all have an obligation to do that work. Elected officials play a role, advocates play a role, the business community plays a role. Every segment of society, every sector of our economy has a role to play in lifting up and affirming the rights of and the dignity of and the contributions of people with disabilities. So we've got to continue to advance disability policy that makes it possible for people with disabilities to be fully engaged Americans, to lead full lives, to enjoy the full measure of American freedom. I want to express my gratitude in particular for the work we've done to the Aging Committee staff, led by our staff director, Lizzie Letter, who's over my left shoulder, and Michael Gamel-McCormick, who's right over on my right and your left, with that cool green tie on. Michael and Lizzie and their team have been extraordinary advocates in their own right, as well as Aging Committee staffers, working on hearings, working on research and investigations and other work on behalf of seniors and on behalf of people with disabilities. So I will, without objection, enter into the record a list of Aging Committee staff members who are members of the staff as of December of 2024 as we conclude this 118th Congress. I also note for the record that we have a former Aging Committee staff director, Kate Mevis, who's in the audience, sitting next to our incomparable Chief of Staff, Kristen Gentile, for their work. Kristen presently and over many years, and Kate when she was a member of the Aging Committee staff and leading that staff in those years. And without objection, Ranking Member Braun's closing statement will be made part of the hearing record. And again, I've enjoyed working with Ranking Member Braun and wish him well in his next assignment in public service. And once again, I want to thank the witnesses, and frankly, by extension, all the witnesses who have appeared before our committee over the years for their contributions. I have 35 statements for the record, some of which we heard today from Pennsylvania constituents that I'll enter into the record without objection. If any senators have additional questions for the witnesses or statements to be added, the hearing record will be kept open until next Wednesday, December the 18th. Let me conclude with just a couple of thoughts about disability policy. We know, as I made reference to earlier, the Americans with Disabilities Act, passed in 1990, set 4 goals for people with disabilities. Number 1, economic security. Number 2, full participation. Number 3, independent living. And number 4, equal opportunity. We've made great strides on all 4, but the full realization of those 4 goals still lies ahead of us. Not just ahead of us for those who will be serving in Congress, but lies ahead of us as Americans. We all play a role in advancing those goals. I leave my chairmanship of this committee with a charge for everyone to continue to build on that progress and to ultimately achieve those goals. It's been an honor to serve as chair of this Special Committee on Aging. It's been an honor to serve in the Senate these 18 years. I want to thank you all for participating today. This concludes our hearing. Thank you.